Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can continue the subject wise discussion. In the previous video we discussed community question and pediatric nursing question. Here in this video we can discuss questions from OPG. The first question, vaginal canal is normally has options are option A, an acid environment, option B, an alkaline environment, option C, neutral environment, and option D, all of this. Correct answer is option A, an acid environment. The vaginal pH from puberty to menopause is acidic because of the presence of Dodderland bacilli. This Dodderland bacilli, which produces lactic acid from the glycogen present in the exfoliated cells of the vagina. So the vaginal pH is acidic in nature from puberty to menopause. Here option A is correct answer. Vaginal canal is an acid environment. Second question, what is the normal length of uterine cavity? Options are option A 5 to 5.5 cm, option B 6 to 6.5 cm, option C 6.5 to 7 cm, option D 7 to 8.5 cm. Correct answer is option C 6.5 to 7 cm. Here question is normal length of uterine cavity. Uterine cavity, that is body cavity, that is inside the body cavity of uterus, that is 3.5 centimeter, and the isthmus is 0.5 centimeter and cervix is 2.5 centimeter. Okay, 3.5, 0.5, 2.5. So the normal length varies from 6.5 to 7 centimeter. The next question, pH of vaginal secretions. Options are option A 3 to 4, option B 4 to 5, option C 5 to 6, option D 6 to 7. Correct answer is option B 4 to 5. The pH of vaginal secretions is 4 to 5. As I already told in the first question, the vaginal pH from puberty to menopause, it is acidic in nature. Okay, here the pH varies with estrogenic activity and the range is between 4 to 5. Okay, usually the pH below 7, it is acidic in nature. Here the pH of vaginal secretion is 4 to 5. The next question, which bacilli is responsible for the acidic medium in vaginal secretion? Option A, Dodderland bacilli, option B, E. coli, option C, Staphylococcus, option D, Streptococcus. Okay, in the first question we discussed option A, Dodderland bacilli, which is responsible for the maintenance of acidic medium in the vaginal secretion. Because this Dodderland bacilli, which produces lactic acid from glycogen present in the exfoliate cells of vagina. So here correct answer will come option A, Dodderland bacilli. The next question, what is the normal position of uterus? Options are option A, anteverted and retroverted, option B, anteverted and anteflexed, option C, retroverted and anteflexed, option D, retroverted and retroflexed. Normal position of uterus is anteverted and anteflexed. Option B is correct, anteverted and anteflexed. The next question, thickest layer of uterus is? Options are option A, perimetrium, option B, myometrium, option C, endometrium, and option D, decidua. Thickest layer of uterus is myometrium. The three layers of uterus are perimetrium, myometrium and endometrium. Okay, perimetrium is the outer layer, myometrium is the middle layer and endometrium is the innermost layer. Okay, this perimetrium outer layer which consists of serous coat, and this myometrium is the thickest layer which is the middle layer and it consists of smooth muscle fibers. And the endometrium is the innermost layer which consists of mucus lining. That is the mucus lining cavity is endometrium. Okay. During pregnancy, this endometrium is changed to decidua. This is an important point. So the endometrium during pregnancy is changed to decidua. Okay. The next question, the process involved in the maturation of two highly specialized cells, spermatozoon in male and ovum in female, before they unite to form zygote is called. Options are option A gametogenesis, option B oogenesis, option C spermatogenesis and option D fertilization. Here correct answer is option A gametogenesis. Gametogenesis is the process of maturation of highly specialized cell, that is spermatozoon in male and ovum in female, before they united to form zygote. Okay, that is known as gametogenesis. This gametogenesis include oogenesis and spermatogenesis. Move on to the next question. The endometrium of the pregnant uterus is known as. Options are option A decidua, option B chorion, option C trophoblast, option D morula. Correct answer is option A decidua. Endometrium is the innermost layer of the uterus. The mucous lining of the cavity is called endometrium. During pregnancy, the endometrium is changed to decidua. So, option A is correct answer. The next question, outermost layer of the fetal membrane is known as. Options are option A amnion, option B chorion, option C trophoblast, option D decidua. Outermost layer of the fetal membrane is known as option B chorion. Move on to next question. Another one important question. In which week the embryo can be differentiated as human? Options are option A 3rd week, option B 5th week, option C 6th week, option D 8th week. Correct answer is option D 8th week. Okay, embryo can be differentiated as human by 8th week. The next question, pressure in the umbilical artery is about. Options are option A 40 mmHg, option B 60 mmHg, option C 10 mmHg and option D 50 mmHg. Correct answer is option B 60 mmHg, pressure in the umbilical artery. There are two umbilical arteries is there. This umbilical artery which carry impure blood from the fetus. Here our question is the pressure in the umbilical artery. Correct, which is 60 mm of Hg. Okay. The next question, pressure in the umbilical vein. Previous question was pressure in the umbilical artery. This is umbilical vein. Options are option A 40 mmHg, option B 60 mmHg, option C 10 mmHg and option D 50 mmHg. Correct answer is option C 10 mmHg. Pressure in the umbilical artery is 60 mmHg and umbilical vein is 10 mmHg. This is an important question. The next question, oxygen saturation in umbilical artery is about. Options are option A 40 to 50%, option B 50 to 60%, option C 60 to 70% and option D 70 to 80%. Oxygen saturation in umbilical artery is about 50 to 60%. Umbilical artery which carry the impure blood from the fetus. So there the oxygen saturation is 50 to 60%. And the oxygen saturation in umbilical vein is 70 to 80%. Okay, umbilical artery is 50 to 60% and umbilical vein is 70 to 80%. The next question, blood flow in intervillous space of placental circulation is. Options are option A 200 to 300 ml, option B 300 to 400 ml, option C 400 to 500 ml, option D 500 to 600 ml. Here question is blood flow in intervillous space of placental circulation. So what is intervillous space? Intervillous space means in placental circulation there is two type of circulation is there, that is uteroplacental circulation and fetoplacental circulation. In uteroplacental circulation, that is maternal circulation, it concerned with circulation of the maternal blood through intervillous space. Okay, it goes to the fetus by intervillous space. So there the pressure is 500 to 600 ml. Okay, so blood flow in intervillous space is 500 to 600 ml. And next question, pressure in intervillous space during uterine relaxation. Options are option A 30 to 40 mm of Hg, option B 50 to 60 mm Hg, option C 10 to 15 mm Hg, option D 50 to 60 mm Hg. Here pressure in the intervillous space during uterine relaxation. Previous question was let flow in the intervillous space. Here pressure in the intervillous space during uterine relaxation. Correct answer is 10 to 15 mm Hg. So I already told in the previous question what is intervillous space. Okay, here the pressure is during the time of uterine relaxation it is 10 to 15 mm Hg, and during uterine contraction it is 30 to 50 mm Hg. Contraction 30 to 50 mm Hg, relaxation 10 to 15. The next question, which germinal layer is responsible for the development of the major structures in human body? Options are option A ectodermal layer, option B mesodermal layer, option C endodermal layer, and option D all of this. Correct answer is option D all of this. So here these three layers which play an important role for the development of major structures in the human body. For example, in endodermal layer which help for the development of central and peripheral nerve system, epidermis of the skin and appendages, pituitary gland, salivary gland, mucous lining of the nasal cavity, paranasal sinus, all developed from the ectodermal layer. And in mesodermal layer helps to develop bones, cartilages, muscles, cardiovascular system, kidney, gonads, suprarenal glands, spleen, and peritoneal cavity, everything which is developed from the mesodermal layer. From the endodermal layer, that is epithelial lining of the gastrointestinal tract, liver, gallbladder, pancreas, and urinary bladder, urethra, everything which is developed from the endodermal layer. So this all three layer which play a major role for the development of major structures in the human body. The next question, the weight of the placenta is, options are option A proportional to the weight of the uterus, option B proportional to the weight of the amniotic fluid, option C proportional to the weight of the baby being roughly 1:6 at term, and option D none of this. Here correct answer is option C proportional to the weight of the baby being roughly 1:6 at term. This is the correct answer. At term, the placental diameter is about 15 to 20 centimeter and the thickness is about 2.5 centimeter at its center, and weight is about 500 gram. The weight of the placenta proportional to the weight of the baby being roughly 1:6 at term. Okay, usually the weight in kilogram or gram, it is 500 gram. It is proportional to the weight of the baby is about 1:6 at term. Okay, so here option C is correct. The next question, fetal blood flow through the placenta is, options are option A 150 ml per minute, option B 250 ml per minute, option C 350 ml per minute, option D 400 ml per minute. Fetal blood flow through the placenta. This is one of the previous question. Okay, correct answer is option D 400 ml per minute. Fetal blood flow through the placenta is 400 ml per minute. This is also one of the previous question. Confusing and twisted question. That's why I included this question also. Volume of blood in the mature placenta. Okay, option A 150 ml, option B 250 ml, option C 500 ml, option D 400 ml. Correct answer is option C 500 ml. Volume of blood in mature placenta. Previous question is fetal blood flow through the placenta is 400 ml per minute. Here volume of blood in mature placenta is option C 500 ml. And the next question and the last question in the series, which hormone is not cross the placenta? Options are option A parathormone, option B insulin, option C calcitonin, option D both A and C. A means parathormone, C means calcitonin. Okay, correct answer is option D, A and C, parathormone and calcitonin, which is not cross the placenta. Here we discuss first 20 questions from midwifery. So in the next video again we can discuss the next questions. Thank you for watching my channel. If it is useful for you people, please share your friend circle.